The flu is widespread in 46 states, including here in Ohio. We're seeing nearly 4 times as many cases compared with this time last year. Now, all this week, we've been providing you with resources to keep you and your family healthy. Well, we checked with some local school districts to see if they're seeing flu cases and what they're doing to prevent the flu from spreading. Westerville City Schools says their nurses are not seeing an increase in the flu in their schools right now. Hilliard City Schools hasn't seen an outbreak either, but they are taking precautions like extra cleaning and sanitizing. Jonathan Alder Local Schools says they sent out a newsletter to the high school talking about the flu, and their PTO asked for donations of extra tissues and Clorox wipes.
What's making this flu season worse? It's the type of flu strain, H3N2. This strain tends to hit younger and older people harder than others, and the flu vaccine isn't as effective fighting this strain. A lot of you have questions and concerns about the flu, so we brought in the experts from Ohio Health and Nationwide Children's Hospital to answer your questions.
That's Dr. Glenn Williams and Dr. Mike Patrick, along with a team of doctors, will answer your flu questions for the next 90 minutes. So if you have some questions, give them a call. The number to call, 614-469-10TV or 855-746-10TV.
And we are helping you stay healthy this flu season. Anyone over 6 months old should get the flu shot. We put an interactive map on our flu story on 10tv.com that we will tell you where you can get vaccinated. And if you have questions about the flu, including symptoms, treatments, or when to go to the hospital, ask these experts. We have these doctors standing by to take your calls tonight. Here are the phone numbers, 614-469-10TV or toll free 855-746-10TV. We'll be right back.
And doctors are in our digital broadcast center tonight for the next hour, in fact, taking your questions about the flu. You can reach them at 614-469-10TV or toll free 855-746-10TV. The news at 5:30 continues right after this.
You can hear it in the office, at your child's school, maybe at church. People are coughing, they're blowing their noses. I might hear it in the studio here. Is it the flu? It's not always clear cut, but here's what you should be looking for in your sick family members and perhaps yourself. The flu will always come with a fever. You may get a headache and a sore throat. Those body aches will make you want to just crawl into bed because you are in pain and you're just plain tired. If you are unsure of whether you have the flu, we have experts in our digital broadcast center tonight to answer your questions. Dr. Glenn Williams with Ohio Health Urgent Care and Dr. Mike Patrick with Nationwide Children's Hospital are here to answer your questions. These are the experts we talk with every week in our What's Going Around segment. You can reach them or our other doctors who have come to our studios to help answer the phones at 614-469-10TV or call toll free 855-746-10TV. And friends, we'd like you to take a look at your screen. This map from the Centers for Disease Control and Prevention shows the states with widespread flu. Take a look at where we are. 46 states in the warm colors, red, orange, and yellow, have widespread flu cases. Dr. Glenn Williams with Ohio Health and Dr. Mike Patrick with Nationwide Children's Hospital are here to answer your questions. You can reach them or our other doctors who are here, and they're helping to answer your questions. You can call them at 614-469-10TV. You can call toll free 855-746-10TV.
Let's go to Health Source 10 now. We are answering your questions tonight about the flu. It is widespread in Ohio, and 2 children have already died from it. So we brought in a team of doctors to answer your questions and to field your concerns. My partner, Tracy Townsend, is with them in the Digital Broadcast Center. So Tracy, my question is about a question. What's the most common question the doctors are getting tonight?
Well, I want to tell you, they are hearing really 2 big questions. What are the symptoms, and can people still get a flu vaccine? And the answer to that question is a resounding yes. And I will tell you that they both agree on that. Dr. Glenn Williams, who is here from Ohio Health, thank you for joining us, and Dr. Mike Patrick from Nationwide Children's Hospital. So they really do have you covered from birth and on in terms of answers to your question and resources. First, want to start by asking you, Dr. Williams, about how we can prevent the spread of flu.
certainly the flu vaccine is one of the best ways to prevent the influenza virus from attaching. So that's the best way. And then also hand washing is very, very important. I mean, it's the old tried and true hand washing, cover your cough. Don't go to work or school if you have a high fever, have the flu. Stay away from others. That's the best way.
And don't be offended if nobody shakes your hands. We do a little fist bump, and it works. And Dr. Mike, how do parents know when it's time to get their child in to see you or somebody like you?
Well, I always say whenever your mom or dad radar goes off, you just have this nagging feeling like something's wrong. Pay attention to that and to give your regular doctor a phone call or have them seen. But generally, if the fever's lasting more than a couple of days, if they have any difficulty breathing at all, if they look like they're working hard to breathe or they're not drinking enough fluids, those would all be reasons to get them seen sooner rather than later.
And you've told people that it's not too late to get the flu vaccine. Who wants to take the question of why there is still time?
Well, there are other strains of flu virus that are out there, and ones that haven't necessarily hit this area yet. And so remember, there are more than one strain in the flu shot, and so things may kind of settle down for a couple of weeks, and then we might get another wave with a different strain. And so you just want to get that protection so that you're protected against any of the other flus that come along.
And Dr. Williams, before we go, more than 20 people on calls waiting to hear from you guys. Some are sick. Once they get through this bout of flu, should they get the vaccine?
They still certainly could, because as Dr. Patrick said, certainly that will cover other strains of flu that are going to potentially be out there. So absolutely.
All right. Okay. The folks who are waiting to hear from you want to hear from you, so we'll let you guys get back to the phones. Thank you so much for coming in and sharing your expertise. And you, too, can get in line and get your questions answered until 6:30 tonight. 614-469-10TV. If you're outside the area, call them toll-free, 855-746-10TV.
Well, the 2017-2018 flu season could be one of the worst in years. The CDC says there's widespread flu activity in 46 states. So take a look at this map. The flu season starts in October, and watch as large portions of the United States turn red in color, indicating a higher flu count. Now, the main strain that is making people sick this winter is the H3N2 virus. Health officials say this bug changes quicker than most, and it's hard to treat with a vaccine. Now, despite that, it's always best to get a flu shot. 10 TV is hosting a phone bank to answer your questions about this year's flu season that has already claimed the lives of 2 children. Tracy Townsend joins us in our digital broadcast center. Tracy?
All right, Yolanda, as you can see, our doctors are still very busy taking calls from our viewers. Dr. Glenn Williams, who's from Ohio Health, and Dr. Mike Patrick, who is from Nationwide Children's Hospital. I can tell you they have received hundreds and hundreds of phone calls. In fact, we may not get to all of the phone calls and your questions, but do tune in to our website and we'll really try to get the answers that you need about the flu. Many people wondering about how to prevent the flu. The doctors are saying, again, that your best bet is vaccination. And Dr. Mike, just getting off the phone. Real quickly before we go, can you tell our friends at home the one thing they can do to protect their family against the flu?
Well, obviously the flu shot is the biggest thing that you can do, especially at the beginning of flu season, but it's not too late to do it. And then you just want to avoid areas where there's going to likely be people with the flu. So shopping centers, grocery stores, sometimes waiting rooms, and just kind of hunker down and stay inside. If you are around, make sure that you're covering coughs, washing hands frequently. Don't touch your face, especially after touching other things.
And if you've been at work all day or at school and you feel bad, you should probably stay home.
Yes, absolutely. Just, take advantage of that. Lay on the couch, drink lots of fluids, watch a little TV, and take it easy for sure.
All right. Dr. Mike, we certainly appreciate you coming in. And of course, Dr. Williams, who's taking another call. But again, Yolanda, we are going to get through the flu season, and the doctors say we're not really close to peak. They don't know that until really after it's all over. So the best bet, get that vaccine and good, thorough hygiene. Back to you.
All right, Tracy, thank you. So call in, get your questions answered. Our phone bank is open until 6:30, so make your calls now. We'll also provide information about the flu on our website. For that, go to 10tv.com. Remember, there is still some time to get your questions answered about the flu and what you can do to protect your family. Doctors and nurses are standing by. Dial the number on your screen right there at 614-469-10TV or 855-746-10TV.